Dr. Mona Hanna Attisha, known as Dr. Mona, she is the daughter of Iraqi immigrants living in Detroit. She's a pediatrician. She has helped expose the Flint water crisis in 2015. Her memoir, released June 2018, What the Eyes Don't See, a story of crisis, hope, and resistance in an American city, has landed on the 2018 Oprah Winfrey's list of the top books to read this summer. In 2016, she was named one of Time Magazine's 100 most influential people in the world. Dr. Mona is with me today to discuss how her family's immigrant roots and activist background influenced her career as a doctor and scientist and inspired her in pursuit of justice and exposing the Flint water disaster. So how are you? Welcome, and appreciate you coming on and your time. Thank you very much.
Brad, it's great to be with you. Thank you.
So Dr. Mona, you are the director of the Michigan State University Children's Hospital Pediatric Public Health Initiative. You mitigated the impact of the Flint water crisis. You're a professor of pediatrics at Michigan State University. How did you get involved in this whole Flint water crisis? What happened?
So for about 17 months, Flint had switched their water source to the Flint River without treating it properly. It was missing corrosion control. Lots of complaints about the water, but I assumed everything was okay.
What year was this?
April 2014.
They switched the water supply. And they say everything's good.
Everything's good for 17 months, despite residents' complaints. They knew something was wrong. There was color, odor, taste issues. But, I was going along my busy work as a pediatrician, and I was believing what the government said. I mean, why wouldn't you?
Are you a resident of Flint? You have patients from Flint? Are you near Flint?
Yeah, so we're actually in Flint right now. Flint. I don't live in Flint, but I work in Flint. And the patients I care for live in Flint. And they were coming to me asking me if the water was okay. And how could the water not be okay? It's, who doesn't assume that when you turn on your tap, your water is not okay?
Who would they complain to?
Everybody, every level of government, the city, the state, federal government, including the EPA. Flint had lost democracy. We were under state-appointed emergency management, and the only focus was austerity to save money. So the voices of the citizens of Flint were being dismissed and denied throughout the story.
Whose ultimate decision was that?
Yeah, it went from the Great Lakes, which we had been getting for half a century.
It's a fresh water source?
And the best, highest quality water source. And it was switched to the Flint River without proper treatment. And that decision was made by the emergency managers who report to the governor. So this was a state-driven decision.
Why was the Flint River being polluted by industry, or is it just a contaminated river just by nature?
That's a great question. So the Flint River has a history of legacy pollution. It's actually caught on fire twice. But the river was not the problem. The problem was the water was not treated with corrosion control, an important ingredient. Without that treatment, the water was about 19 times more corrosive. It ate up our pipes. Lead from our pipes went into our drinking water and into the bodies of our children.
What was the savings that they got from switching the water source?
Maybe about $30 million to switch from the Great Lakes to the Flint River. However, it only would have cost $80 to $100 a day to add this proper treatment chemical that was not added. And that was not added, and the pump to install that treatment chemical was never installed. So there was really never even an intention to treat this water properly.
So they were complaining that there was a smell to the water?
There were citywide complaints about odor, quality, taste. Bacteria was in the water. Chlorine was added, which irritated people's skin and eyes. Lots and lots of issues. Parents coming in with vague complaints about children. But for 17 months, everybody was being reassured. Even when General Motors, which was born in Flint, after just a few months of the water switch, noticed that their engine parts were corroding from this water source, and they got a bypass to go back to the Great Lakes, but the people of Flint were literally told to relax.
What were they saying to try to convince the public that this was safe water?
That the water is testing fine, that it meets compliance guidelines. Literally, one government spokesperson said that you can relax, that if you're worried about lead, you should just relax. So lots of reassurances about all the multiple complaints that were coming in about this water.
So when did you start trying to connect the dots, saying, wait a second, something is wrong?
My eyes were opened when a girlfriend of mine, high school girlfriend, who happens to be a drinking water expert, was at my home and shared what she knew, which was that the water was not being treated with corrosion control, and thus we would have lead in the water. And from that moment on, I began this almost quest to uncover what was happening to our children.
What does lead do to children? What does lead do to adults?
Great question. And that's when my life changed, when I heard the word lead. Because as a pediatrician, we know what lead does. It is a poison. It's an irreversible neurotoxin with no safe level. It impacts children's cognition, dropping IQ levels, impacts their behavior. It alters their entire life course trajectory. We're never supposed to expose them to lead, because really we are only, when we detect it in a child, it just tells us there's an environmental problem.
What did you do at that point? Where did you go about trying to find this proof?
When I heard this, I knew I needed proof. I needed the population level data, and I wasn't getting that. Nobody was giving it to me at the county and state level. So I decided to do my own research with our hospital records to see what was happening to the lead levels of our children. So Mark Edwards, a scientist from Virginia, had come and done water testing of all of Flint, working hand in hand with the people of Flint, and had scientifically proven there was lead in the water. It's like, this guy is a genius, one of the world's experts in lead and water. And he was also being attacked. The book really goes through that fast-paced research of what we discovered. And what we discovered was an increase in the percentage of children's lead levels after the water switch. And I walked out of my clinic and I stepped into a press conference and shared that research. And that is not something that doctors do. But at this point, we had no other choice. I had no other choice. As a physician, I literally took an oath to protect children. I stood up and said I would be the voice of children and be their protector and healer. And we did. And just like everybody else in the story, we were also attacked. My science was attacked. My credibility was attacked. And the facts and the science were dismissed. They said I was splicing and dicing numbers, that I was an unfortunate researcher, that I was causing hysteria, and that their numbers, the state's big data, was not consistent with my data.
Did you ever doubt your research?
The book goes through those incredible, powerful emotions, because for a moment I felt I was wrong, and I was scared, and I was sick, and there was a knot in my stomach that would not go away. When the entire state tells you you're wrong, it's hard not to believe them. But that lasted a few moments, and ultimately the kids put me back in this fight, because I was fighting for their future, for the lives that were growing inside them and their entire potential. And they got me back, and they got me back with punching bags on.
How did you eventually convince the authorities that you were correct, or did you first convince the public you were correct, and then the authorities had to come around? Which way was it?
Yeah, so when we had our press conference that shared this data, the public finally breathed a sigh of relief, because they knew something was wrong, but they didn't know what. It was a validation of their concerns, so they were obviously on board and had been on board. And then after a few weeks, finally the state went back, looked at their data, and conceded and said, our data are consistent with your data. There is a lead problem. So ultimately, it was our science that spoke truth to power.
How long was it from the time that you exposed this in your press conference to the time that the state and the EPA said, you're right, Dr. Mona?
It was a matter of a couple weeks.
And then at that point, what did you do? What did the state do to try to rectify this?
So within a few weeks after that, we went back to Great Lakes Water. And from that very moment of recognizing that we had this population-wide exposure, my focus went to the hope. What was happening in the water was threatening the tomorrows of all of our children. And from that moment on, my focus went to the preserving the tomorrows of those kids.
Now, they're still having problems today, because those pipes that the bad water from Flint River was going through are still contaminated. So even though you have fresh water coming from the Great Lakes, in 2018, 4.5 years after you exposed this, nobody can drink the water in Flint still.
You're right. So the 18 months that we were on corrosive, untreated water ate up our pipes. So we are replacing those lead pipes. When we complete that, we'll only be the third city in the country that's done that. But that takes time. And while that's happening, people need to continue taking precautions.
Now, besides lead, was there any other poisoning from this water source?
Yeah, lead is only a small part of the story. We also had one of the largest outbreaks of Legionnaire's disease. Adults, especially elderly, contracted pneumonia and died. At least 12 confirmed deaths from Legionnaire's disease and an overall uptick in pneumonia mortality. Because of that, state officials are actually charged with negligent homicide because of those deaths.
They killed people and told people it was safe to drink this water, and it wasn't. So did you testify before Congress about this?
Absolutely. They had several hearings. I was called to testify twice at the U.S. Congress as well as at the state level.
Did Congress do anything, or was it all talk?
After a year and a half of advocacy, Congress finally passed a Flint bill in December of 2016 to help with our pipe replacement and to fund our registry. But that is just a down payment. We need long-term resources.
So who's supplying the water now to Flint? You still can't drink it out of the pipes.
No, the state ended bottled water supply, but there is a supply of filters for the next 2 years.
Why would the state end it? They caused this problem.
They said that our water is testing better and that they no longer have to supply it. But it should have continued. Our water is testing better, but because of the infrastructure work, there's still risks.
Tell us about your book a little bit and where you can find it. And then I want to find out a little bit about your background and your history.
Sure. So the book is available everywhere. Like you mentioned, it's on Oprah's summer reading list. This book, like I mentioned earlier, is so much more than just about Flint. You know, it is ultimately about people, places, and problems all over that we choose not to see. And it is about our obligation as human beings, our civic responsibility to open our eyes and to care for these populations and to be aware of these injustices. It is also an immigrant story. And I don't think that part of this book would have been as big if it wasn't for the last election. I'm a first-generation immigrant. We came to this country when I was 4, very much for freedom, for opportunity, for democracy, for that American dream. And that was realized for me and my family. Lady Liberty opened her arms for me and my family, and that is not happening today.
I would say there's a direct correlation between what happened to the children in Flint and what's happening to children on the border right now in terms of their emotional growth and their emotional stability. You want to talk a little bit about that? What happens to children in stressful situations and what stresses children and how that affects them growing up? Because it was a stressful situation knowing you can't drink water or you may get sick, and it's a stressful situation being separated from your family.
So the same mechanism that is happening for the children at the border is what's happening in Flint. We call this toxic stress. This is probably the most important concept right now in pediatrics and public health. It is the recognition of early trauma, early life trauma, on what happens to the lifelong development of children. It's the same thing as what's going on the border as in Flint. Children are rattled with so many toxic stresses from poverty, violence, separation of parents, incarcerated parents, lead poisoned water. All of these are toxicities.
How are these kids, what's the scientific evidence that how are they going to function as adults?
Yeah, so the treatment is being buffered by a supportive caregiver in your lives. So reunification is number one. They need supportive parents, caregivers to buffer these toxicities. If they are not properly treated, we know that they will then engage in, they'll have developmental delays, things like bedwetting, anxiety issues, depression issues, mental health issues, increased risk-taking behaviors, substance abuse, higher likelihood of chronic diseases, and actually a decreased mortality. Years will be cut off of their lives if this is not treated properly.
You were born in England. You're from Iraqi descent. You are Chaldean. For those who maybe you know more about your culture than me, I'll tell you what I know. You are Christian Catholics, but of Arab Iraqi descent. How did your family come to America?
Yeah, so I was born in England. My father was completing his PhD. The plan was to go back to Baghdad. That's where home is. That's where family is. Arabic was my first language. However, that's when Saddam Hussein was rising in power. And very quickly we saw his tyranny, his fascism. And my parents knew that they could not go back home with 2 small children. So we immigrated to the States. My father then did a postdoc. It was an education visa initially, continuing his research in metallurgical engineering. And then he eventually got a job with General Motors, and we settled in Michigan for 30 plus years.
How old are your children right now?
They're 9 and 12.
Your children were 4 or 5 years old when you were doing this, and you're still doing it to this day. What do you teach your children about democracy, about standing up for your rights, about government transparency? How do you teach your children about this and right from wrong?
The lens that I see the world as an immigrant is somebody who is every day grateful to be in this country. Every day I wake up lucky to be in America. But it is also a lens that acutely knows what injustice is and what people in power can do to vulnerable populations and how important it is to be in a democratically free society. And so those are the lessons that I teach my children. And to no matter where you are, you work for justice. It's being part of this borderless cause. It's not about race, religion, or country. It is about service and justice.
What is your individual American dream? Have you reached it? And what is your societal American dream?
I have absolutely been blessed and privileged to achieve that American dream. That was realized for me and my family. But for the kids that I take care of here in Flint, they wake up to a nightmare. And that is not right. There are absolutely two Americas. There are some American dreams that are impossible for some children in certain zip codes.